is your Filipino radio experience in Las Vegas. PHLV Radio.
PHLV Radio.
The Philippine Nurses Association of Nevada now brings you Philippine NARS, news and features about the Filipino-American nursing community and beyond. And now, here's your host, Doris Bauer.
Well, good evening, Philippine NARS listeners and followers. Magandang gabi po sa inyong lahat. Thank you so much for joining us again here at Philippine NARS. I hope that your new year is getting better than last year. As you all know, Philippine NARS is brought to you by the PNANV, or the Philippine Nurses Association of Nevada, in collaboration, of course, with our favorite radio station, PHLV Radio. So we know the events of this past week in our capital was very unsettling to most of us. And the COVID pandemic has reached some very unsettling results and statistics. So we at Philippine NARS are mindful of these events, and we would like to just remind you, our followers, to please stay safe out there. Be mindful of your surroundings, and please take care of each other. And as much as we would like to talk about our current events, our community still has a lot of healthcare issues and events and services that will need information on. So tonight, we are going to talk about skilled nursing facilities for children. I know that you know that we have many skilled nursing facilities for adults, but very few for children. And we're talking about children who need long-term care, kids who have trauma-related injuries, and other diagnoses. Tonight, we have guests who can talk about this particular specialty care. Please welcome from Silver State Pediatric Skilled Nursing Facility, Mr. Brandon Murphy, Mr. Daniel Mathis, and Mr. Doug Springer. Welcome, gentlemen.
Hello.
Hi. Thank you for joining us today. I have a little bit of an introduction, but I would like you to complement it if you could. Okay. So let's start with Mr. Brandon Murphy. Brandon is the Director of Nursing for Silver State Pediatric SNF, and he has more than 10 years of experience in pediatric nursing, and most recently served as a nursing professor at the Arizona College in Las Vegas. He also has worked several departments at the University Medical Center, where he last served as a charge nurse for the general pediatric and pediatric intensive care unit departments. Am I right, Brandon?
You are correct.
Okay. Do you have anything to add to that?
No, I am the RN. I'm also the RN member of the Nevada State Board of Nursing.
Oh, nice. I better watch my P's and Q's and just Yeah, thank you. Thank you for that. Okay, and Mr. Daniel Mathis. Daniel, as far as I can tell, you are the administrator of Silver State Pediatrics, and you are also the CEO for Pure Care Living, which is the parent company of Silver State, correct?
That's correct.
Okay. Do you have anything to add to that, Daniel?
Yes, we've been working on this project for about 4 years and almost 5 now. And we're in the licensing phase of the development. And we're looking forward to having our first admission in the very near future.
Very good. Very good. Okay, thank you. And Doug, Mr. Doug Springer is a respiratory therapist.
Correct.
Doug, tell us a little bit about yourself.
Yeah, I've been a respiratory therapist for over 40 years. I worked in 72-bed NICU. I've also built a couple of different ventilator units for skilled nursing facilities here locally. They were very successful. When Daniel and I got together, gosh, it's been a year and a half, I guess. since we've been working together on this project. There's such a need for this here in our community, and it's a great project. So
That's great. That's good. Well, welcome, gentlemen. Thank you for joining us today. So, and feel free to, any one of you can answer these questions. My first question to you guys is, tell us about Silver State Pediatric Skilled Nursing Facility. What is your mission?
So the mission for Silver State Pediatric, Nevada is, although one of the larger states, is a very small community. And the state of Nevada has contracts with providers in other states. And when you need this very specific type of nursing, a lot of Nevadans were having to go outside of the state to receive the service. So skilled nursing in our will be pulmonary based. So we have our medical director is a pediatric pulmonologist, and the programming, will follow that licensure.
Very good, very good. So, there's not many pediatric nursing skilled facilities out here. So I'm so glad you guys are here. So how did you make an assessment to open a pediatric skilled nursing facility here in our community? Do you have any Nevada statistics that show the need for this service?
Yes, actually, we did a research project, and we polled all of the hospitals. We pulled the data. We were looking at how many days that that Nevadans had to spend outside of the state receiving care. And then we talked with a lot of the pediatric pulmonology or pediatric physician groups and hospitals, UMC being the main one. Dr. Mina Vora gave us a lot of information. And all of the data that we had pointed to the fact that Nevada was simply underbedded. Nationwide, there's only about less than 60 of these facilities in the entire country. And Nevada having contracts and talking to the providers and the need to be able to admit and keep the families together in our own state, spoke to that. And then as we reached out into the community, we were lucky enough to find Brandon. And he is not only works in the very specific pediatric care community, but he's also a special needs parent. And so, I don't want to speak for Brandon, but it was just another example of where people that live in Nevada had to go outside of Nevada for services. And then additionally, statistically, if you look at rankings by CMS for skilled nursing facilities, Nevada traditionally is ranked, toward the bottom of the in the data. So, so any way that you look at it, there was a need for the beds in Nevada. Now we look to serve the entire state of Nevada, and then possibly those small communities that are close to Nevada in Arizona, Idaho, California, Utah.
Yeah, that's good. Brandon and Doug, do you have anything to add to what Daniel has said?
I would add that I would piggyback on the fact that this service is needed in Nevada. As a pediatric nurse, going back 6 or 7 years ago, there was no such thing as a pediatric skilled nursing facility in the state of Nevada. And since then, a couple have been developed. But I remember sending kids to Arizona for long-term care. Yeah. The other thing is, being a special needs parent and kind of being in this community, we know that there's really not a place currently for our higher acuity patients. So kids that are ventilator dependent specifically, there's really not a lot of places for them to go. And then, so what ends up happening is we send them home. And you have to question sometimes whether sending a child with high acuity and chronic needs, sending them home, you got to question whether that's like the safest option.
Yes.
And acute care hospitals really are just not equipped to do effective discharge planning. And so it is not our hope for kids to come here and live here forever. That is absolutely not our goal. Our goal is to get them home, but in a safe environment and be able to do the discharge teaching that the families need. As a special needs parent, I remember taking my very first special needs kid home. He's trach and G-tube dependent. And I was the charge nurse of the pediatric unit at the time, and I was overwhelmed bringing him home because even as the charge nurse, we're supposed to be the expert, right? And we're supposed to understand how to take care of these kids. And from an acute care perspective, I certainly did. But being discharged from a skilled nursing facility with the expertise that they had helped me better be prepared even to be at home.
At least it is a midway, like a segue to finally being accepting them at home. I work in the home arena on home infusion, and so we see a lot of these patients, who are not really ready for home, and they are being sent home because there's no other available service that can actually, accommodate their needs. So I'm so glad.
and our hope is to be able to pad that need.
Yeah. Okay. Doug, do you have anything to add to that from your perspective?
No, I was actually talking with our doctor today, and then that's one of the things that we're going to really push on is getting the kids out of the hospital where we can work with the parents and get them home in like 2 weeks or so, 1 to 2 weeks. So with the extra training, we'll have a little extra more time than the hospital would. So that's kind of what our goal would be.
Yeah. Well, so I heard your facility was really good and, great facility. I was not able to tour your facility, but members of a couple of board members of the Philippine Nurse Association and PHLV Radio had actually toured your facility, and we have some footage to show our viewers. So let's pause a little bit and show that video footage.
This room is really important to me for a number of reasons. This is where a lot of our PT and OT will happen, but it also will double as our treatment room. So one of the cool things that our architects did is include oxygen and vacuum and medical air in the wall. That's for two reasons. One, our 2-year plan is to take high acuity ventilator dependent children. But for two, we will be able to perform minor procedures in here. Nothing that, of course, would require sedation. But if somebody needs a PICC line or an IV, it can all happen in here. If a physician needs to do a minor procedure, it will happen here. I also want to point out the beautiful artwork in here. Again, kind of creates a fun environment. All of our artwork in our building was donated to us by artists who donated or volunteered their time, and we are incredibly grateful for them. It is important to both our administrator Daniel and myself that staff also enjoy working here, and so we'll be able to use our dining room both as an employee dining room but as well as a staff dining room. It's important to me that, especially for our CNAs, if the patient is eating, I hope that the CNA will sit and eat with them. I want to show you our playground. We're calling it our top lot. So I want to point out this is Charlie. Charlie is our mascot. So keeping in the theme with our name of being Silver State Pediatric and this being the Silver State. Charlie is the state bug. He's a dragonfly. What type of dragonfly?
Vivid dancer damselfly.
Vivid dancer damselfly. So he's our mascot, and so he is hidden throughout the building in our artwork. And this will eventually be replaced with a multi-sensory board that's got different textures. But he's just kind of the mock-up. So there's like little buttons or something and different textures so the kids can touch him and feel him play. I want to point out how wide the rooms are. I also want to point out the fact that our architects thought to put the oxygen on the sides of the wall. And that's important to me because traditionally what I see in a lot of these facilities, they put the oxygen in the center. The center of the room becomes very cluttered. The respiratory therapist or nurse comes in to adjust something, and as they do that in the middle of the night, they bump it and it wakes up the neighbor. And so our hope is to eliminate those needs. When these doors or curtains are completely closed, these rooms become quite private. Another piece of artwork that I absolutely love. It's an Indian with a dream catcher, and she's dreaming of kids playing. How cool is that? That's Chance. This is my CPR baby. And so I'll introduce you to Chance, just because Claudette just pointed him out. Chance was my very first baby. I'm an educator. I enjoy teaching. Teaching is going to play an important role. One of the important things to me is that our staff, all of our staff, be completely comfortable with trachs. That way, if one comes out or we have an emergency, everybody that's licensed and has the ability to manage the trach will be comfortable. My son has a tracheostomy. I once heard our ear, nose, and throat doctor say that if the kid's trach comes out and we're at the grocery store, I should be able to be picking avocados and put the kid's trach back in at the same time. I have, without blinking, and I have the same expectation for staff. Trach comes out, it goes back in, no stress, simple.
Bluetooth is on.
So one of the cool things that we want to do in here, well, it is a salon, so we'll be able to do kids' hair, not us. Now, we have a licensed beautician that's actively in the process of getting this thing licensed in the state of Nevada. But she'll be able to cut hair. But I also want to be able to do as much complementary alternative therapy as we can in here. I hope that this is a place for kids to come, staff to come when they're stressed out. One of the things that we've done is we put this glow thing in here, where when the room is dark enough, it glows. It connects to Bluetooth, and we can play music through it.
This is a Ventec ventilator. It is actually made by Ventec, but it's called the Voskin. The Voskin actually stands for ventilation, oxygen, cough assist, suction, and nebulizer. It has a 5-in-1 machine. We're the only ones in the state that have these. They're very popular in Hawaii. In fact, Hawaii has now gone to all of this machine. But we are the first ones here to do it. So they are very state-of-the-art. We can actually do a cough assist with a patient, these kids that are needing it. Runs off of 2 batteries. The batteries last for 9 hours a piece, so about 18 hours I get off of these.
We plan on having a high acuity facility to serve the Las Vegas and the greater Nevada area.
That was really good. Thank you very much to PHLB for showing us that. So it's great. It's good. So what services are you going to offer in your facility?
Well, that's I'm not the clinician, and I'll warm Doug up for a second. I'll throw it to Doug. So in Nevada, the specialty rates or the reimbursement from Medicaid is called Specialty Care 1, Specialty Care 2, and they're basically pulmonary programs. And one of the innovations that Doug brought to the table was the type of ventilator that we're going to use. So I'll let Doug talk a little bit about that. So Doug, if you would, tell us a little bit about the ventilators that you brought to the table, my friend.
We have a new state-of-the-art. It's a 5-in-1. It's called the Vosin. It's made by Ventec out of Oregon. And they have come up with this new vent that's just outstanding. Has 5 modalities built into the vent. So we can do the ventilator, which goes anywhere from NICU to adult, from ICU to home care.
Wow.
So then it will also has a concentrator. So it'll supply its own oxygen if we need it. It's has a cough assist, a suction machine, and a nebulizer, all built into an 18-pound box.
Wow,
So,
that's great.
oh, it's amazing. It's an awesome machine. The gentleman who actually invented the LTV is the person behind this. He's been working on it for about 10 years, and he's done a wonderful job. We fell in love with the event. Our docs love it. Everybody's really enjoying it. So
Good. I'm going to have to come see it.
definitely.
Yeah, definitely. Right. Okay. So besides the pulmonary aspect of what other, what would you describe the patient base that you're going to have? Maybe Brandon can answer this from a need standpoint and from a diagnosis standpoint.
Absolutely. So a lot of our patients will have chromosomal abnormalities, maybe have been born with special needs. So they will have graduated from the NICU. Traditionally, I think what happens oftentimes is kids go from NICU, they go home for a couple of days, they end up going back to PICU. Again, that's not our goal, right? Our goal is for them to be able to come here and to be able to safely transition home. That way we decrease the return to acute rates, right? The amount of time and the number of times that children return to an acute care hospital after having been discharged. And so sometimes they'll come directly from NICU, from whatever chromosomal or birth abnormality they may have had. Some of our kids will have suffered what we term in the pediatric world as a non-accidental trauma. That's usually child abuse, right? So these are kids that are shook or suffocated, kids that are very badly beaten, that have often resulted in injuries that prevent them from going home safely, anoxic brain injuries, for instance, right? Multiple broken bones. Sometimes those kids will come here. And that's horrible, but unfortunately, it's the reality of the pediatric world. We will take care of children that have suffered traumatic brain injuries from things like not wearing their helmets during sporting activities, or motor vehicle crashes, not wearing their seatbelt or the car seat correctly, right? One of the things that we know about children, and depending on what statistic you cite, is between 80 and 90% of car seats are incorrectly installed. Get into a bad motor vehicle crash on Nevada highways, especially, right, at those highway speeds, those kids end up with very severe traumatic brain injuries and often end up vent dependent, sometimes end up vent dependent. Those kids will come here.
Yeah.
Some of our kids will,
go ahead. No, go ahead. Finish.
I was gonna say, some of our kids will come in as a result of foster care needs. So mom and dad can't handle it, right? Or they have some might sometimes even less severe medical needs, but like a feeding tube, and mom and dad can't handle it. Or chemical dependence is another big issue that we know exists in Nevada. Sometimes parents suffer with that. So sometimes those children, when they have medical needs, will come to us.
So a big part of your program will probably be education as well to the family members, right? Okay.
That is an accurate statement.
Yeah. Okay. Well, that's good. That's good. So what healthcare staffing are you going to need, or at Silver State, what are their duties going to be? I know nursing for sure, right?
You want me to take that, Brandon?
Yeah, please do. Yeah.
All right. So besides the pulmonary component, skilled nursing facility, they call them nursing facilities for a reason. Anything that's skilled nursing care, everything from IVs. Then we have LPNs for medication, and then we have CNAs that are going to participate in the therapy component. We have PT, OT, ST, physical therapy, occupational therapy, speech therapy. We have child life. We have an affiliation with the school district, local school district. We've got our own beauty shop. We've got a full dining. I love to say we have one of the best kitchens in Las Vegas. We're open 24 hours, 7 days a week, Christmas Day, New Year's Eve. So, it really is really a self-sufficient building. So we're really pleased with, all the levels that we've got. We've gotten some really great staff. We hadn't talked about the therapy component, but the therapists that we've recruited have deep experience in the pediatric culture or caregiving. And we have a consultant that was a director of nurses for Shriners Hospital for Crippled Children that's helping us get up and get started. I've got Bill Ross is a licensing specialist here in Nevada that's helping us get ready. It really has been a community support. And we're having really good luck with recruitment. So we have a lot of staff to choose from. We're being very picky about who we hire. And we're trying to create a culture there that is going to try to raise the bar a little bit. So, and then Brandon is, of course, the tip of the spear there. His experience is, he was a little modest. He didn't tell you that, he started as a CNA and worked his way up to an RN, master's level or higher, current educator. So we really feel confident in our folks and their skill sets. So we have a well-rounded team. The kitchen is going to have a gumbo shop flair. I've got to have red beans and rice on Monday and gumbo on Friday, right? So
Awesome.
we're just working on every component of a skilled nursing facility. Lately, we've worked on our emergency program, and if there's an earthquake in Las Vegas, it'd be a good idea to end up at Silver State, right? Where the way that we constructed the building, the emergency supplies, everything down to the generator. I mean, we've got, I noticed I've got to go out and buy a CB radio because in our emergency plan, we've got to have a CB radio. So we've got a great group. We've got great programming. Our medical director, Dr. David Parks, and UNLV School of Medicine has really done great. We had a good meeting with him today. We feel really confident.
That's good. You're going to have social workers as well, or?
Absolutely. I've met social workers and child life. So yes, as well.
Okay.
We
Okay,
will be
good.
one of the only pediatric skilled nursing facilities that I know of to utilize child life specialists. And so child life is a unique discipline in healthcare where they help children learn about their medical needs, but also learn about the healthcare system. So I like to call child life specialists developmental experts. We all learn about child development in our educational programs, but most of us don't get master's degrees in it. And that's what these individuals do.
Oh, that's great.
Huge
So
respect.
are you having any trouble with staff recruitment for office?
We are not having any trouble with staff recruitment. We have the staff that we need to open, which is great. I would say that, we have our website. I encourage people to apply. We, like Daniel said earlier, we are really looking for a specific individual. We want positive, high energy people that want to learn. I'm not necessarily looking for experienced pediatric nurses. I would love them and they are welcome to apply. But more than anything, I want people that are going to come to work and be happy, work hard, people that are going to love our children like their own, because I can teach the skill.
Right.
So RNs, LPNs are certainly welcome to apply.
That's great. That's wonderful. And what kind of insurances are you going to be taking?
We are a Medicaid facility at the moment. We're going to open as a Medicaid facility. We're going to get comfortable that we will open the doors up to private insurance.
The private insurances later. Okay, very good. So are you going to take any COVID patients?
The goal with COVID is no. And so our hope is to not take COVID patients. Could that potentially happen? It could. And if it does, we'll follow CDC guidelines on cohorting and managing COVID patients.
Of course, of course.
Daniel or Doug can speak to that more if they'd like, but.
Doug, what do you think about that?
Yeah, Doug can cover that, absolutely.
Sorry, Daniel.
I was going to let you go.
Either way, I'm okay as well.
Go for it. Go for it.
All right.
I'll let you.
So here, our stance on COVID is twofold. Brandon's right. We're not going to seek a COVID positive admission. Part of the discussions that we've had with the local providers, because some of the hospitals in Nevada are converting parking garages into patient areas. So what we would like to kind of interject into the community is if we can free up 36 med gas beds by taking those non-COVID ventilator dependent pediatric, they'd have to fall in our range. If we could, I mean, it's a tight goalpost, but statewide, there might be 36 people that would qualify for admission and free up 36 beds that could be used to treat, somebody that's seriously sick in an acute environment that, and right now, those 36 beds would be welcome. So, we are thinking about it. We think about it every day. We're already, starting the protocols on coming to work and the testing. We're, reaching out, in Nevada, skilled nursing facilities because the conversion rate is over 10%. Skilled nursing employees have to be tested twice a week. So we're already, getting that lined up and starting that process. So, we take it very seriously. We would, we're not going to admit it, but we'll also have a plan ready if there is some kind of contamination. We've applied even for the inoculations that are available in skilled nursing facilities. We're trying to work through that. We don't have a license yet, but we do have a paid application. So, we're working every angle for sure.
Good. That's great. So I also was reading that you are allowing local artists to paint murals on the walls of your facility.
We are.
Can you tell our listeners of yours how this program came about and what do you aim to achieve with this program and how did the local artists respond?
Wow, that's a great question. No. It's a relief. It's a relief from the questions I normally have to answer. No, so it really was a program born we started going to the building as the construction was completing, and the walls were all white, all the same color. It looked, but we have these big walls in the grand hallway, and we had these walls that presented themselves as just crying for a mural or something. So we worked with our PR firm, and we just put out a notice to the local artists that we would supply supplies if they would just give us their talent. It really wasn't in the budget to pay artists, and they really came out of the woodwork. We had over 11 artists that actually did murals in the building, and they did it in the public spaces. They did it in some of the individual rooms, and it really converted the building into something else. We really had when the artists were there, and so the construction was pretty much done except for some finish work when we started, and it really turned into kind of an art festival atmosphere, so much so that one of our employees ended up spearheading the project and ended up doing now 2 or 3 murals of her own in the building. So kind of a discovered skill set. And that was our occupational therapist that did that. I'll throw a shout out to Lucia Mathis.
All right, that's great. So
But she coordinated everybody and got them all to come in, and really worked with them over a period of probably 5 or 6 weeks.
That's good. So Brandon, you think the murals will be some kind of a stimulus for the patients
and staff? In fact, one of them's right behind me. The artist did a beautiful job.
Yeah. How would that affect a pediatric patient?
It gives them something to look at. It's fun. One of our murals is 3D. So in 3D glasses, the way I didn't even know this was possible, but the way the artist painted the mural, it pops off the wall.
Wow.
With 3D glasses.
Oh my goodness. That's great. That's great. Okay. So, what are your current challenges in your facility? Opening up, and you guys you're opening up real soon, right?
Yep. So I'll start. So the challenges are, for me, and I'm just the lowly administrator. The administrator has to make sure the clinicians have what they need to get their work done. It's not an easy question to answer. I don't know. I guess the biggest challenge is taking people that are used to working in an acute setting, and the transition from acute care, like Brandon is used to, like our medical director is used to, like a lot of the nurses that we've recruited are used to. Skilled nursing is a higher level of regulatory compliance, a lot more documentation, a lot more policy and procedure driven. And then the other thing, the regulations and the policies are driven toward a geriatric patient, like the quality measures that CMS use. Now we're going to have a CMS provider number, and we have to do an MDS like we do for anybody else, like any other skilled nursing facility. And all the questions and the quality measures and everything are aimed at that geriatric patient. Well, geriatric nursing doesn't work in a pediatric environment. So the hard thing for me, and I see some of the other hospital clinicians struggling with it, is just the shift of the acute to the subacute or to the skilled nursing. And so, and I'll let Brandon answer and Doug answer, but for me, that's the challenge, is trying to get these skill sets of pediatric pulmonology and Brandon's skill set of working in PICU, NICU into a skilled nursing environment. And it's just, it's difficult.
Yeah, definitely, for sure, since they don't have specific regulations for that. Brandon, so what do you think? What would be, or what challenges are you going to have, or do you currently have?
The challenge is, this is very unique. Like Daniel said, we estimate somewhere between 50 and 55 similar facilities nationwide. There's just, when you look at the number of adult skilled nursing facilities in the state, right, probably closely matches that. But and we're trying to do this in the pediatric world. We're unique. We're a unicorn, and so we have all of our policies through a subscription-based service that meets all of Centers for Medicare and Medicaid Services guidelines. But like Daniel said, they're all adult-driven. One of the unique things that I was going through a policy the other day. We have to do training on dementia, but we're a pediatric facility, right? So somehow I have to be able to meet state and federal guidelines, but also meet the needs of our patients. And so I've got to take that training that I've got to do, I think, quarterly on dementia, and somehow make it relevant to our patients, that way I'm not wasting anybody's time and still doing right by the staff, right? And the kids. So that has been my challenge. The other challenge is I'm an acute care nurse. And so I'm not used to it. Literally every step of the way in skilled nursing, everything is a policy. And so It's just not that way in the acute care world. I'm used to charting every, hour, minimum every hour on an ICU level patient and every 4 hours on a general med surg or peds floor patient. And in skilled nursing, it's once a shift. And so I've got to wrap my brain around that and still meet the needs of the kids.
Right. Well, that's totally different, a big shift from you. Yeah. Mm-hmm. So from what you're used to. So yeah, that would be a challenge in teaching and, the providers, what they're used to and what they're going to have to be used to. Right.
Sure.
Yeah. And Doug.
Right. Well, like one of the biggest quality measures, like just as an example, are pressure sores. That's a big deal in a geriatric facility, but that's not going to happen
for kids.
Or the comorbidities aren't going to be there for pediatric, yet we have to document toward defending against the pressure sore. So those are some of the challenges. So that was a clinical example of some of the struggles I've seen.
Yeah. What about you, Doug? What's your challenge? What's
documentation, training for documentation, that kind of stuff. That just getting everybody through all of our training programs and that kind of stuff. Getting the staff through it, that kind of stuff. So.
Oh, good. Okay. So you said there's probably only like 55 of the type of facilities that you have here in the entire country. And of course, you have a lot of hurdles and still a lot of unknowns. Do you think you would be participating in some maybe policy changes that could happen from in the government and government insurance stuff? Is there has this been started? That you know of?
I can talk a little bit to that. So I've been involved with the regulation of nursing practice, I think since 2011 or 2012 from a board of nursing perspective. Mm-hmm. I personally have served 2 terms on the Nursing Assistant Advisory Committee, which is a committee that reports to the board of nursing on issues related specifically to the CNA. That's hugely beneficial to me in that a lot of what we did on that committee directly related to skilled nursing, because that's where those certificate holders work. I served 1 term as the CNA member of that committee. I also served 1 term as the acute care RN representative. I also served 1 term on the Nevada Board of Nursing's Education Advisory Committee. This is a committee that is responsible for the regulatory oversight of all of Nevada nursing programs, RN and LPN schools. I am currently the I am the RN representative of the Nevada State Board of Nursing. And so to answer your question, it gets very tricky when I get involved with the policy change in that because I hold that state level role, I can't independently go out and advocate for change. The ethical way, the legal way to advocate for change is in my life, at least as it is now, is to do that in an open public meeting at a board of nursing meeting. And so I can't really speak for the board of nursing, but if somebody has a need or an issue, there's always public comment available.
Yeah.
Policy changes is good for an organization like the Filipino Nurses Association, right? The Nevada Nurses Association and others.
Okay. Yeah. Well, I understand the whole Nevada State Board of Nursing. What I mean is, from a countrywide standpoint, like lobbyists or whatever, those who are catalysts in changing, the world, that would make it a lot easier for you guys for, regulation and accreditation is what I meant to. So, are you? Yeah, right.
No, so I would, I'll horn in here. So I do love to lobby. I do intend on going to Carson City during the session that'll start in the next 5 weeks shortly. And I will be advocating for policy updates at the state level for Medicaid And in my past, I have been to DC representing the state of Nevada on skilled nursing issues through my work with the Nevada Healthcare Association. And that's something I've been doing for years, and I plan on continuing to do that. Part of, and Brandon may be hearing this for the first time today, but I do plan on bringing Brandon and Doug to Carson City with me to testify if the opportunity comes up.
Thumbs up. Very good. Very good. I'm really excited because this is new. I know there are very few of your type of facilities. So where are you guys located and how can people contact you?
So we're at 2496 West Charleston Boulevard in Las Vegas, Nevada. They can contact us on our website, Silver State Pediatric SNF.com. And there's a place to communicate and tell a little bit about us. We're about to update the website and really expand our social media and really reach out. We've been waiting for our license. And then now that we're in the final phases of the licensing process, we will have a vibrant presence online.
That's great. And is info@purecareliving.com, is that how they're going to be able to get in touch with you? Or
yeah, that's a really good email. Info at Silver State Pediatric SNF is a great one, and you can see that on the website as well. So yeah, thank you.
All right. Okay. So what is the final question? Do you have anything else to add maybe some questions about your facility that I missed? You want to talk about it?
I want to add one. So one of the things that's really important in Silver State Pediatric skilled nursing facility is food. Food is going to play a big role in what we do. A lot of the children that we will serve will have feeding needs. And one of my strengths, I'm a special needs foster parent on top of everything else that I do. I'm a special needs foster parent. And one of the things that I really like to do, one of the one of the child populations that I specifically like to target are kids with feeding needs. And so our most recent foster baby came to us 100% G-tube dependent. And we were able to work with our speech therapist and our occupational therapist. And we did an intense refeeding program where we were able to get her to down to 1 G-tube feeding a week. And she's only been with us for a few months. And now she gets to be adopted by a cute little family, which is great for her and great for us because now we'll have a new opening in our home. And I hope to be able to do that here as well. As kids have feeding needs, I really want the cafeteria, our dining room, to be a home-like atmosphere. I want our staff to sit down and enjoy a meal with a kid. I was a CNA instructor for a long time. One of the things that really drives me crazy when I go into a skilled nursing facility is when I see CNAs standing next to a patient, feeding them as they're standing up and talking to their friend. It is really important to me that when kids are eating, that staff sit down next to them and enjoy a meal with them. And we help them eat. We model that behavior just like we do at home. For breastfeeding moms, this is also another area that I'm very passionate about. Feeding is important at Silver State. And so my hope and my expectation is that breastfeeding moms eat and babies eat anywhere that food normally happens. And that is absolutely not the bathroom, which is where we see on a lot of facilities. To me, that's absolutely disgusting and not okay. So one of the things that I did is I worked with our occupational therapist, who is one of our artists, and she created a mural in one of our rooms. And we're going to put a recliner and a breast pump in there. And the moms that want privacy, as they pump or breastfeed, will have a private room to go into, or they are welcome to feed anywhere that feeding would naturally happen or eating would naturally happen.
That's wonderful, Brandon. That's great. That's great. Anything to add to that, Danielle or Doug?
I'll let Doug go first.
Oh, I'm okay. We're hitting everything good.
Yeah.
Right.
Good.
Well, the only thing that I'll add, I'll make it non-clinical since I'm not a clinician, that we do have a mascot, and it is the vivid dancer damselfly. It's a dragonfly. So, if any of your listeners or followers feel like compelled to send something to the building, make it dragonfly based. And that's our mascot. And he'll be represented. He's on the website and he's hidden in several of the murals. And we got a whole storyline around him. And he's going to be a lot of fun.
Dragonfly, eh?
Yes.
Yeah, well, why don't we ask our listeners to do that?
Yeah, send us some dragonflies. Not really.
Yeah. It's a vivid dancer damselfly. Yeah, why not? It's I've got a shirt and it's in our logo, and it's turned out to be an awesome thing. It became the state bug. It's the official bug of Nevada, and was made the official bug by an act of the legislature. And I've reached out to the legislator that proposed it to see if he'll come and give us a speech or take a picture with our mascot. So we're very proud of him.
Right. I did not know that fact about Nevada. So that's great. Okay. So what is your message, lastly, to the community and our healthcare workers, as to end our podcast?
Just be careful, take care of yourself. Right now the healthcare workers are, they're heroes. I saw a t-shirt I liked the other day. It's save one life. You're a hero. Save 100 lives. You're a nurse.
You're a nurse.
I really liked it.
Yeah, that's good. I have a keychain that says, I am a nurse. What is your superpower?
That's good too.
Isn't that good? Cool. Doug, what is your message to the community and the healthcare workers?
Again, I'll just echo on Daniel. Stay safe. That's the big key right now. Stay home if you can. So that's another one. So, yep.
Wear your mask.
Wear your mask.
For sure. Sure. And Brandon, you'll have the last word.
I would say get your car seats checked, wear your helmets, and be careful around pools.
All right. Okay. Well, thank you so much, gentlemen. Brandon Murphy, Mr. Daniel Mathis, and Doug Springer, for joining us today. We so appreciate the information. And so to everyone if you are in need of the Silver State Pediatric Services, hopefully in the future, you can visit their website and you can email them. Again, they are at 2496 West Charleston Boulevard, Las Vegas, Nevada, 89102. Okay. Thank you again. And
thank you for having us.
Yes, thank you very much.
You're welcome. Looking forward to visiting your facility too. So, all right.
All right, us too.
And to our listeners, we leave you with this tidbit of information. According to the Nevada Independent News, which was the article dated on June of 2019, Nevada lands at the bottom of the list, this time ranking the best and the worst states for children's health care. However, many of our Valley healthcare professionals say that, well, they're optimistic that medical services for kids are going to improve in the state, even if it's happening slower than anyone would like, quote unquote. So we are happy to have Silver State Pediatric Skilled Nursing Facility soon in our community to help our pediatric care issues. So thank you very much. And just in closing, to our listeners and followers, we are still in the middle of this pandemic. We are hopeful for the existence and the availability of the COVID vaccines, which in all reality really is the light at the end of this tunnel. Please, we ask you to still mind the guidelines of this pandemic, wash your hands, wear your masks when in public, and maintain social distancing. This is the only way we can get through this. Take care and be mindful of yourselves and each other. This is Doris Bauer, your Philippine Nurse host, signing off for now.
The Philippine Nurses Association of Nevada has just brought you Philippine Nars, news and features about the Filipino-American nursing community and beyond. Fridays, 7 p.m. on PHLV Radio.